into words.
Dr. Ehrenhaus, as a practicing corneal specialist, are we doing anything like this in the U.S.?
For the cornea, it's a little bit different. We don't have any chips that we can regain vision with. We do surgeries that sort of do something similar. But what's amazing with what he has, as far as I know in the States, it's not there yet. I know there have been some procedures that they're working on and certain macular procedures. But what this chip does is it's essentially putting somebody who's in a dark room and putting the lights on for somebody.
Right.
It's really
but so far as, let's say, restoring vision, when you're talking about retinal disease, like, you know, let's say if you had retinal detachment, significant retinal detachment, where are we in the field of retinal surgery or the therapies that can really either completely stop the progression of blindness in somebody who has retinal disease, right? Because there are many diseases, right? Diabetes, for instance, is one that comes to mind, and we have a diabetic epidemic in this country where 50% of everybody has diabetes, and so if they don't realize that, we're going to have a lot of blind people pretty soon roaming around the States.
There are new treatments that a lot of the retina doctors are using, sort of patients that might come to me with a corneal issue or a bad cataract that have diabetes at the same time, and you look inside the eye, and the back of the eye has, as we tell the patients, you have sugar. You have diabetes in the back of the eye that needs to be treated. When it's early on, some of the lasers are working very well, but some of the newer injections that are out there, things to sort of stop the proliferation of growth factors and causing neovascularization, vessels that don't belong, those injections have actually come a long way, and studies continue to go on to help prevent further regrowth of these vessels and patients actually regaining vision and stabilizing. With a retinal detachment, it's a little bit different. You sort of can't say, I'm going to prevent it or stop it from happening. If it happens, you have to treat it, and surgeries have done very, very well. It's a matter of an anatomical success versus regaining vision, and that just depends on how quickly you can get to them.
I remember when I was a resident, I used to, you know, I started in anesthesia first. Do you guys still do the sclerobuccal surgery?
I don't, but some of my colleagues do, yeah.
They still do that, and that's basically when you put just a band around the eye, right, just to hold it in place.
Got to put some stitches in it, but yeah, it works very, very nicely for some patients.
Well,
it's there to push the tissues back together.
Right.
Dr. Ehrenhaus, to continue on Manny's theme here, why aren't we doing this in the U.S.? This sounds so revolutionary. Is it just so brand new that it happens to be something he invented? Will we be used?
I think down the line we will. It's the same with a lot of other technologies that, you know, again, as a cornea person or a front of the eye person, sort of the window to the world that he works in, if you will. The studies are continuously coming out. A lot of things don't start here, and a lot of things do, and you have to go through the channels.